Mr. Chairman, I've got an amendment that I'd like to get voted on, and I think that can happen when we get a quorum, but I'd like to speak to it, and it deals with this issue of telehealth. The cost and burden of caring for seniors is steadily increasing, and if given the choice, we know a lot of seniors would prefer to live independently with minimum intervention from the caregiver. And there are a lot of important innovative technologies that are rapidly emerging that offer seniors the option of living at home without jeopardizing their health or safety. Unfortunately, the Medicare program is not keeping up with advances in technology. By providing a demonstration project on remote patient monitoring, we can start Medicare down the path of leveraging technology to help ensure that seniors remain in their homes longer. This technology can help prevent costly hospital admissions and readmissions. A recent study performed by the Commonwealth Fund shows that using remote patient monitoring can reduce hospital readmissions and increase patient satisfaction. This amendment would create a pilot program to provide incentives for home health agencies and other entities across the country to use home monitoring and communications technologies, giving seniors greater access to the care they need and the ability to stay in their homes. Home health agencies or other entities participating in the pilot program will receive incentive payments based on a percentage of the Medicare savings achieved as a result of the pilot project. This remote patient monitoring amendment is designed to be budget neutral in its payments to home health agencies or other entities. So I would also ask for HHS to establish a more formal mechanism to determine how remote monitoring services can further enhance the value-based performance program. The VA, Veterans Health Administration, is the most notable example of home telehealth service taken to scale. The VHA piloted, evaluated, and deployed home telehealth and found it can lead to cost-effective quality outcomes for chronic care patients. So, Mr. Chairman, I would ask, it's Amendment number 2, that at the appropriate time when we have a sufficient number of senators here to have this voted on. And I would like to ask, as long as we have the folks from CBO here, if perhaps they could give us a little bit of insight about how they score these types of technologies and the contribution they make to reducing some of the payments made out under Medicare. The CMS data that I have shows that for 2011, CMS paid under $7 million on telehealth claims. The number is quite different than what CBO estimated when the current Medicare telehealth structure was created in 2000. At that time, the CBO said telehealth policy that is now in law would cost about $30 million a year. And I would note that this is not additional reimbursement. As we know, telehealth encounters and reimbursements are just the same as in-person reimbursements, but just through a different medium. And I raise the issue because I think that the assumptions that are made about telehealth by CBO may not be accurate, and there have been a lot of studies done recently suggesting that that using telehealth can actually achieve savings. And I want to make sure that CBO is considering the latest data when it considers telehealth programs, proposals, and how those might be scored. So I would ask you to perhaps comment on how you look at those issues and commit to working with my staff to talk in greater depth about how you currently view telehealth and ways to approach this issue going forward.
So, Senator, as I mentioned earlier, we have not had time to look at the amendments specifically. So we have not had time to look at your amendment, but we are happy to do so. As a general matter, when we think about provisions regarding telehealth, we try to look at the number, try to assess as best we can the extent to which the particular services would be used, the cost, the price that would be set for those services, and then also the effects on the use of other healthcare services that might arise from the use of telehealth. We will certainly take on board whatever information is available, and we look forward to talking with you and your staff if you have information that you've seen that we have not seen. I can't speak to the particular projection from 2000. I wasn't there. I haven't learned about it since then, so I don't know what may have changed over time in the way the healthcare system evolved or the way the laws were changed that apparently made the costs come in much less than we'd expected. But we try very hard to learn from errors in our projections previously and to take on board the best available information at any point we make an estimate. And we'll do that in this case for you, Senator.
With that, Mr. Chairman, I will, when the appropriate time comes, ask that this amendment be voted on and yield back. Thanks.
Yeah.
I'm sorry, Mr. Chairman. Mr. Chairman, if I might ask that that be voice voted.
Yeah,
Okay.
Senators, we now have a quorum for the purpose of voting. For information, if Senators are present, this is maybe the Senator, why don't you describe him? This is Thune number 2 on your sheet. I guess it's round 2. It's on the second sheet. Senator Thune number 2. Co-sponsor, as I understand it, Senators Casey and Enzi. You want to describe your amendment again?
I very quickly, Mr. Chairman, can say it's the short title basically is to provide a demonstration project on remote patient monitoring in the Medicare program to ensure seniors can remain in their homes longer and to prevent hospital readmissions. And it is designed to be budget neutral in its payments to home health agencies or other entities, but something that I think in terms of the ways in which we treat people, allow them to live more independently and be taken care of in their homes with the technologies that are available today. This is something that I think we not only are seeing a lot of providers proceed with, but we need to make sure that the Medicare rules for reimbursement keep up with that technology.
No. Final passes. We're not far away. All right. The questions on the amendment offered by the Senator from South Dakota, amendment number 2. All those in favor say aye. Aye. Those opposed, no. The ayes have it. The amendment is agreed to.